Well, before I couldn't talk, so there was no communication skills. I couldn't voice anything to the doctors or the nurses or to my family, and with a PV valve, I could do that.
What type of health concerns or other types of concerns did you have that you were not able to voice?
Usually it was trying to describe the pain that I had, or discomfort, where they were just prescribing painkillers or sedating me where I didn't need it. So I was more medicated than need be because I couldn't communicate the level of pain or issues I had. I had a lot of, because I was on a lot of medication and then with the feeding, I had a lot of nausea and I couldn't communicate when I was being moved or transported or shifted or something. So I was vomiting a lot. So having the valve, I could communicate that no, I can't stay at this position any longer, or I'm getting nauseous, I have motion sickness, issues like that.
And even we're not using, and like before, he always used anxiety medication, right? So after we started using the Passy Muir Valve, he doesn't need that, and he more relaxed. That's why from the full support and then like assist control, we transition to inline Passy Muir Valve. Then from there, we just the transition to the cool aerosol, and then he feels more is comfortable like a transition, without like difficult. We gradually increase the hours every day, increase the 4 hours. He just and smoothly is complete of the event. So actually, from his experience, we found out that Passy Muir Valve not only for the swallow and also the speech, okay, also help the patient weaning from a high the ventilator support to transition to spontaneous breathing.
So Neil, when he was admitted here, he wasn't wearing the speaking valve. Obviously, he wasn't eating. He wasn't safe to swallow. And we started him on trials as soon as he was able to wear the valve. I started doing trials with ice chips, thin liquids, and he did that pretty well. I just actually started him on a diet earlier this week. He was on a puree diet, thin liquids, and he tolerates that pretty well. Right now, he's doing trials with a dysphagia-free mechanical soft diet, which I am going to advance him today. Swallowing-wise, he does really great. He listens to do all the compensatory strategies, and I've explained to him how the speaking valve helps with his swallowing and how it decreases the risk for aspiration. So initially, when Neil was admitted, he was on a size 8 cuffed Shiley trach. Immediately with the cuff deflated, with the speaking valve in place, he was able to tolerate the valve. He didn't have a hard time wearing it. Again, in the beginning, his voice was very nasally. He also had a hard time managing his secretions. Coughing up all of his secretions. And secondary to the size of the trach, it's fairly big. It's a size 8. Our pulmonologist just wanted to make sure that respiratory-wise he would stay stable. He'd wean off for 24 hours, and then before we downsized the trach. So he was able to accomplish that. We've downsized him to a Cortex 7. And as soon as we downsized it to a Cortex 7, we actually capped him, and he tolerates that very well. His voice is much improved, less nasality as well, and he's also better at coughing up most of his secretions, so he doesn't require too much suctioning.